Without further ado, so you already know, I'm Val Wolf, and I'm the implementation team lead for the OC Disease Action Plan, and I actually co-lead it with Stephen Grossman from the Prevention Office, who's here, Stephen. And then I will invite other people from the implementation team and the working groups to stand up. I won't necessarily take the time to introduce everyone. Come on, everybody, stand up. Who's here? See, it's a lot of people. A lot of smart, committed, and energetic people that are working together to try and address and prevent occupational disease in Ontario. So let me take a quick flip through. I hope this. So I'm just going to lightly, as I said, introduce the plan and why we thought we needed one. We did an exercise of ranking, and I'll show you what that looks like. We came up with 5 priorities. Action plans are traditionally built by approach, so I'll show you some of the items under each approach for the plan, and then the implementation, talk a little bit about challenges, and then, as I said, we'll have the working groups present on where they are and where we're going. And I think that based on Minister Flynn's talk and already some of the presentations that, like for instance, Paul's, we realize and recognize that occupational illness is under-recognized and it's under-reported and undercompensated, but that also means then it's not recognized and treated equally. Occupational health issues aren't treated equally as safety issues in the workplace because they're hidden and there's less tangible and less saliency. I really like that word that Sophie mentioned this morning, although I do have to apologize for the 100 times that she said the word behavioral. I do have to actually mention that, although from a marketing perspective, that's a really important thing to think about how we nudge people. But the idea of the presentation wasn't to say, if only we could just fix those workers, we'd get everything figured out. So I just have to give a little pause and caveat about that. But I think we'll talk later about communication marketing and how we need to think in those terms of the nudging terms and the context and that kind of thing. So the action plan, and I always like to say that the action plan is built upon previous work. We're not revolutionaries, really. We're just lucky to have assembled a group from a variety of perspectives and able to sort of capture the energy and the awareness in the ministry, in more than one ministry, and in the public domain about occupational disease. And we're just trying to marshal that and move forward. And so the plan itself was finalized last December, and the implementation started in January. And it is a confirmed, what we call a system priority with respect to the operational planning of the whole prevention system, which includes the ministry, various departments of the ministry, including the Prevention Office, includes the 6 HSAs, includes the WSIB, and there also are the Centers for Research Excellence that are part of the prevention system. It's a priority for all of us in this fiscal and next fiscal. The consensus when we got the reference group together and started looking at data was that just in general, there's a lack of awareness among the health and safety system and workplaces. So within our own system, as well as out in workplaces, about occupational disease. And part of it being that people felt, in many cases, if they recognize that it's harmful, then there's harm happening. It was considered to be an iceberg that just couldn't be dealt with. So the real reason for the plan was try to make the iceberg into ice cubes and deal with them one cube at a time. So the prioritization, I'm covering here, was based on, and this is the initial prioritization, was based on addressing exposures versus disease, so because we're trying to address what's in the workplace that we can change that can improve health. And so that our priorities would be based on high volumes of workers exposed, so that a prevalence, we would call that short-term outcomes are actually attainable and even measurable, so we can actually build on success. So that was part of our, so it doesn't mean that we necessarily chose the most egregious or the most prevalent, but it's all part of this. And that there's a capacity and an opportunity for intervention, so that there's maybe a regulation, maybe another public awareness that makes something. It's a good time to work on this issue. And there was also a consensus that we couldn't ignore new and emerging issues as well. So this is a chart that summarizes a priority ranking exercise that each member of the implementation team with their organizations fed into last summer. So it was in July of 2016. You can see the 12 things that were ranked, and they were ranked based on need and based on impact or the potential for impact. And you can see that the top 3 were the same in, like they were the top 3 in both need and impact. And in fact, although, for instance, asbestos is very high on the carcinogen list and solar is very high on the carcinogen list as far as number of workers exposed and the potential for causing cancer, other things rose to the top this time, which does not mean it won't, that solar and these other ones won't rise again. But at this time, it was thought that noise was chosen because of its sheer prevalence, partly because of the complacency about it as an occupational disease, not really recognized as having a significant life impact on people, the noise-induced hearing loss, and because there was a new legislation that came into force in July of 2016, so which meant that noise regulations that had previously been narrowly applied in industry were now applicable in every workplace in Ontario, which was a huge advancement from an OC perspective, and so it was trying to leverage that legislation and to raise awareness about noise as a hazard and about the legislation in order to get noise controlled in more workplaces. Allergens and irritants was chosen. It's, once again, a very wide in prevalence because there's so many people affected and not well understood in the medical community, not well understood in workplaces or by workers, the connection between things that their skin and their lungs are exposed to and the resulting asthma or dermatitis, that there's a connection with work. And because that connection with work is not recognized, prevention is basically not even considered. So it was considered to be, there's a big need for more to be done with respect to awareness and information about allergens and irritants. And then diesel was chosen partly because of its carcinogenicity, blah, blah, blah. And it had just recently been added to the IARC Level 1 list, but also, once again, because it's not understood or recognized as a carcinogen in many places. It was still, particularly a year ago when we did this, it was still news to many people. And that there is a widespread exposure to some levels of diesel, and of course significant exposures in some places, like in mining and in transportation. So those were our top 3, but we're not disregarding the rest of the list, and they are still on our minds and in our thoughts, and the individual organizations that are involved in the implementation team still work on, depending on their clientele and their mission, they still work on a number of the other hazards. So the 5 priorities then of the plan are to raise general occupational disease awareness, of which this is an example. Doing this event annually is meant to build capacity in the system and also to share knowledge, to do that knowledge translation to hopefully take back to workers, to worker advocates, to workplaces, so that we can make a difference about these things. And that's one of the reasons why we videotape and put it on our website, so that we can make this more broadly accessible than here. Noise, allergens and irritants, as I talked about, diesel, and emerging issues. So, as I said, the plan itself is based on approaches, and as I think Paul already alluded to, data and understanding, being able to draw and patterns of association, and even data with respect to prevention, being able to demonstrate that in workplaces that use this type of a machine, there's less noise-induced hearing loss than workplaces that use that type of a machine, that kind of thing. We don't have very good data on exposures, and we have almost no data connecting worker health with where they work and what they do. So that's intelligence. It was considered to be a key approach, and in fact, we ended up deciding we needed a whole committee to look at it. But one of the things that is a priority and is being worked on interministerially is to try and get occupation embedded into the EMR. Although what we've come to recognize actually is that occupation, that there's already a column for that in the EMR form, it just never gets filled in. So we'll be working on trying to figure out ways to make that easier, we need to find the nudge for the EMR, whoever's typing things in, or whether workers can do it themselves, whatever. We're exploring things like that, but it's considered to be a key priority for future intelligence about the connection between disease and work. And then we also wanted to try and find some exposure data, which I think Victoria will talk about, and then to better mine existing data. So there is data, some data at WSIB from claims that have been allowed and even claims that were submitted but not allowed that can be mined for patterns potentially that we haven't looked for before. Research and data management is similar to intelligence, but it's actually going out and fostering new research to be done or asking research questions in a different way. And partly it's also to be finding what research is out there that would be relevant to our deliberations. So some of that was done at the beginning, and it's an ongoing exercise because lots actually that's really relevant has been published in the last year, including the Burden Report. And so that's maybe the only one I want to highlight here, but we also, part of our initiative is to highlight or identify emerging issues that could then inform the Ministry of Labour Research Opportunities Program, for instance. So that's an element of this approach. This one is highlighted in red because it's of the long plan, it's the piece of the plan that's the full system priority for 17-18. And 18-19, and it's to develop and implement a communications and marketing plan, hence our opening speaker, focusing on raising awareness of harm. So we want people to understand these things are harmful and the impact of the harm is significant, but the other key thing is prevention, that prevention is possible. So it's kind of a dual, it was interesting to hear Sophie's language around that, right? So we want people to be afraid of the hazard, but what we really want them to do is enable them to take steps, at all levels of the workplace to drive prevention. And that's for noise, allergens and irritants, and/or diesel, as well as the underlying theme of general awareness. And in fact, the plan entertains, and we have now recently received funding from the Ministry of Labour to create a website entitled preventocdisease.ca, and that's something that the committee will be, or that the implementation team will be feeding into, and that we hope to be developing in the next few months. Advisory and support services is also an approach. So this is around the HSAs who do consulting in workplaces and other people that answer inquiries, being able to deliver information around OC disease. And part of it is internal capacity building so that each HSA brings their staff to have a better familiarity about the priority hazards and then also what they advise to workplaces. And part of it was targeting around that noise regulation. Education and training obviously considered to be significant in knowledge translation of the hazards and the prevention, and so that's a significant section of the plan. In fact, 2 pages worth, as we say, and some of it is targeting to joint health and safety committees. So what we're trying to do is find influencers within the workplace to be able to drive change and make a difference. So that's one of the factors in that. And then enforcement legislation and programs is kind of wrapped up here, but although they are separate approaches in the plan. But for the Ministry of Labour, which actually the Minister already talked about and we may talk about later, adding a focus of OC disease to some of the blitzes, to some of their inspections and that kind of thing, and that's already happened in the last year. And then, of course, there's always lobbying going on around, as we've already heard a couple times today, about policy changes. So review and consider opportunities for regulatory change where there may be appetite and appropriate and be able to make a case. And then also trying to integrate OC disease into some of the, employer incentive programs that WSIB does, or accreditation as it gets developed, that there would be occupational illness and occupational health and occupational disease would be factors in those. And that's ongoing. And the implementation structure is pretty much that the reference group that developed the plan became the implementation team last January, led by Stephen and myself. And the team itself sets the principles, very much grounded in the hierarchies of prevention in terms of targeting primary prevention in the workplace where possible, but also recognizing that secondary and tertiary prevention add value and circle back to drive prevention. And particularly also the hierarchies of control, where we want to eliminate the hazard where possible, and then along the path, and then at the last would be at the worker. So, and the team reviews implementation quarterly, and we really need to maintain the momentum and strengthen the network. So you guys now are all part of the network. You didn't know that when you came here, but you're being indoctrinated. You can't tell that, but I'm nudging you. You just don't know that I'm nudging you. I don't know what part of your brain that I'm addressing, though. So, and I'm not going to say any of you are part of the 5%, though. I'm not sure about that one. But we do have 5 working groups. One targeting that EMR issue, as I said, that we identified as being key, an intelligence and data working group, a diesel engine exhaust working group, and an allergens and irritants working group. And they're all meant to conduct an environmental scan, and then prioritize and activate the pieces of the ODAP that are most relevant to their hazard, because they're all at different stages of evolution in terms of awareness and in terms of tools that can be provided, that kind of thing. And then identify deliverables and quantifiable measures of success. So you're going to hear from each of those working groups in a bit. So just this is my roundup slide, which I guess I could do at the end, but I'll do it now, and then we can hear from everybody else. Is that basically the plan has created energy and momentum to address a large, complex, and poorly understood issues. That's really what we're trying to do. The efforts and success are affected by many external and competing internal factors. We all know that there's so many things that can harm people, so many things that can hurt people, and so many things that can draw attention away. And we live in a very noisy world as far as, beware of this, beware of that kind of thing. So it's a challenge. My analogy, which I developed for the Sudbury Lung Cancer and Mining Conference, is that I think of the implementation team as an orchestra. So we all come with different instruments. We come even from different organizations, so our instruments may be even affected by that. And we've written music, we're trying to play music, and then in subgroups, the working groups are like chamber orchestra versions of the bigger orchestra. But what we really need is a choir. And so we need all of you and many, many more people to be part of the choir that engages in occupational disease prevention as a priority in all that we do. And yes, we will be reviewing the priorities annually, and input and ideas are always welcome to any of us. And today is October, so it's our celebration of OC disease. And well, I'm saying thank you at the end, but thank you for your interest and your voice. I'm interested in hearing everyone's voice talk about OC disease here and beyond here.